In 2023, a 68-year-old American retiree living in Bali suffered a stroke. He had been there for 2 years. He had done his research on cost of living, on visa requirements, on rental prices. What he had not done, what almost nobody tells you to do, is build a medical evacuation protocol before he needed one. The nearest internationally accredited hospital was in Singapore. The medevac flight cost $74,000. His travel insurance policy had a clause that excluded pre-existing cardiovascular conditions. He paid out of pocket. That $74,000 was not a tragedy that happened to a careless person. It was the entirely predictable consequence of a gap in healthcare planning that affects the majority of retirees who move abroad, because the content they consumed before moving told them where to find cheap apartments and good coffee, but never walked them through the single most financially catastrophic risk they were taking. This video does that. We are going to cover every layer of the overseas healthcare problem, what Medicare actually does and does not cover the moment you leave U.S. soil, how to evaluate international health insurance without being misled by comparison websites, what JCI hospital accreditation means and why it is the only standard that matters, and the one document you must carry with you at all times that could save your life and your savings simultaneously. This is the video I wish existed before most expat retirees made their decision. Problem amplification. The single most dangerous belief in retirement abroad planning is this: I have Medicare, so I am covered. Let me be precise about what Medicare actually does outside the United States, because the answer is almost nothing. Medicare Part A, hospital insurance, and Medicare Part B, outpatient medical insurance, do not cover care received outside the United States in the vast majority of circumstances. There are 3 narrow exceptions. If you are in the U.S. when a medical emergency occurs, and the closest hospital is in Canada or Mexico, if you are traveling directly between Alaska and another U.S. state, and a Canadian hospital is closer, and in certain border crossing scenarios on cruise ships. That is it. Everything else, every doctor visit, every specialist consultation, every emergency room admission, every surgery, every prescription, every ambulance ride, every medical evacuation flight, is your personal financial liability the moment you establish residence in another country. Medicare Part D, prescription drug coverage, similarly does not cover medications purchased outside the U.S. And Medicare Advantage plans, which are private insurance alternatives to traditional Medicare, explicitly exclude international coverage in virtually all cases. This is not obscure fine print. This is the fundamental architecture of the Medicare program. But because most retirees never plan to leave the country when they enroll, and because the content ecosystem around retirement abroad rarely engages with this at the level of precision it requires, the gap between what retirees believe their coverage provides and what it actually provides is enormous. And that gap can be measured in tens of thousands, sometimes hundreds of thousands, of dollars. Micro audits. The 4 layers of protection. Let me walk you through the 4-layer healthcare protection framework that every retiree moving abroad needs to have in place before they get on the plane. Not after they arrive. Before. Layer 1. International health insurance. This is your primary medical coverage once Medicare becomes inactive as your main safety net. The international health insurance market for retirees is large, complex, and full of policies that look comprehensive on a comparison website and fall apart when you actually need them. Here is what matters. First, geographical coverage zones. Most international health insurance policies are priced and structured around coverage zones. Zone 1 typically means worldwide coverage, including the United States. Zone 2 means worldwide excluding the United States. Zone 3 means your region only, Southeast Asia, Europe, Latin America. The premium difference between Zone 1 and Zone 2 is significant, often 40 to 60%, because U.S. medical costs are so anomalously high that including them dramatically increases insurer risk. For retirees who plan to visit the U.S. regularly to see family or doctors, Zone 1 coverage is essential. Do not purchase a Zone 2 policy and assume you can manage U.S. visits with travel insurance. Travel insurance and international health insurance are not the same product. Second, pre-existing condition handling. This is the clause that destroys the most claims. International health insurers handle pre-existing conditions in three main ways: full exclusion, meaning the condition and anything related to it is never covered; moratorium underwriting, meaning the condition is excluded for the first 2 years and covered thereafter if you have had no symptoms or treatment during that period; and full medical underwriting, meaning you disclose everything up front, pay a higher premium, and receive a clear written statement of what is and is not covered. For retirees over 60 with any cardiac history, diabetes, prior cancer, or orthopedic conditions, full medical underwriting is the only safe approach. It is more expensive and more administratively demanding. It is also the only option that gives you certainty. Third, direct billing versus reimbursement. In a medical emergency, the last thing you want to be doing is paying a hospital bill up front and submitting claims for reimbursement later. Direct billing agreements, where the insurer pays the hospital directly, exist with most major internationally accredited hospitals. Confirm that your insurer has a direct billing agreement with the specific hospitals in your destination country before you purchase the policy. The major international health insurers worth evaluating for retirees include Cigna Global, Alliance Care, Aetna International, AXA Global Healthcare, and Bupa Global. Safety Wing's Nomad Health product has expanded its older age coverage and is worth comparing for budget-conscious retirees under 69. Premium ranges for a couple in their early 60s with comprehensive worldwide coverage, including the U.S. run from $600 to $1,400 per month, depending on deductible level, coverage limits, and pre-existing condition status. This is not cheap. It is also significantly less expensive than the financial consequences of being uninsured during a serious medical event abroad. Layer 2. JCI accreditation and hospital selection. Not all hospitals in your destination country are equal. This is not a reflection on the country's medical culture. It is a structural reality of how healthcare systems develop. In every country on the retirement destination list, Thailand, Portugal, Panama, Malaysia, Colombia, Costa Rica, Spain, there exists a two-tier hospital system. The public tier is available to legal residents, is generally competent for routine care, and is profoundly variable in terms of English language capacity and equipment modernity. The private tier ranges from excellent to exceptional, and a subset of private hospitals in each country have pursued Joint Commission International Accreditation, JCI. JCI is the international arm of the same organization that accredits U.S. hospitals under the Joint Commission. A JCI-accredited hospital has met rigorous standards for patient safety protocols, clinical quality measures, infection control, medical staff credentials, and patient rights. As of 2026, JCI-accredited hospitals exist in all 7 of the primary retirement destinations this channel covers. In Thailand, Bumrungrad International and Bangkok Hospital in Bangkok, Chiang Mai Ram and Bangkok Hospital, Chiang Mai in the north. In Portugal, Hospital da Luz Lisbon, CUF hospitals across the network. In Panama, Hospital Punta Pacifica, which operates under a Johns Hopkins Medicine International affiliation. In Malaysia, Gleneagles Penang, Sunway Medical Center. In Colombia, Clínica Las Américas and Clínica Medellín in Medellín. In Costa Rica, Hospital Cima San José and Clínica Bíblica. In Spain, multiple private hospital networks across Madrid, Barcelona, and Valencia. The practical rule is this: research the JCI-accredited hospitals within 45 minutes of your intended residence before you decide where to live. If the destination you are considering does not have a JCI-accredited facility within that radius, you are accepting a meaningful elevation in medical risk. This is a non-negotiable filter for any serious retirement relocation decision. Layer 3. Medical evacuation coverage. Medical evacuation, medevac, is the process of transporting a patient from a facility that cannot provide adequate care to one that can, including internationally. A medevac flight from Southeast Asia to Singapore or Bangkok costs between $15,000 and $50,000. A medevac flight from Latin America to the United States ranges from $20,000 to $85,000, depending on distance, aircraft type, and medical staffing requirements. From Europe to the U.S., costs can exceed $100,000. Medevac coverage is either included as a rider in comprehensive international health insurance policies or purchased as a standalone product. The two most widely used standalone providers among the expat retiree community are Medjet Assist and Global Rescue. Medjet Assist operates on an annual membership model, approximately $350 per year for an individual, $550 for a couple, and covers air medical transport to the hospital of your choice in your home country, not just the nearest adequate facility. This distinction matters. If you want to be transported back to your own cardiologist in the U.S., rather than treated at a local private hospital, Medjet Assist provides that option. Global Rescue adds a security evacuation layer and operates its own medical teams rather than contracting third-party transport. Annual membership runs approximately $329 for an individual. For retirees with significant pre-existing conditions, combining a comprehensive international health insurance policy with a standalone medevac membership represents the most complete protection architecture available. Layer 4. The Medical Information Document. This is the layer that costs nothing and is almost universally neglected. Before you move abroad, you need to create and maintain a current medical information document, a single printed, wallet-sized or folded card that contains the following: your full legal name and date of birth, your blood type and Rh factor, a complete list of current medications with generic names and dosages, a list of known allergies including medication allergies and reaction type, your primary diagnosis history, cardiac history, diabetes status, prior surgeries, current conditions, a list of implanted devices, pacemakers, joint replacements, stents, with model numbers and implant dates, your international health insurance policy number and 24-hour emergency claims line, your medevac membership number and emergency line, and your emergency contact's name, phone number, and relationship. This document should be carried on your person at all times, kept in your wallet alongside your passport, and stored digitally in your phone's medical ID feature and in a cloud document accessible to your emergency contact. In a medical emergency, particularly one involving loss of consciousness, stroke, or cardiac event, this document is the difference between the local medical team having the information they need to treat you safely and them making decisions without critical clinical context. It takes 2 hours to create. It should be updated every 6 months or whenever your medications or conditions change. Now, even with all 4 of these layers in place, there are 2 scenarios that catch fully prepared retirees off guard, and this channel's job is to make sure you know about them before you need to. The first is the coordination of benefits problem. If you maintain Medicare Part A and Part B while living abroad, which many retirees do because surrendering and re-enrolling can create permanent premium penalties, You may encounter a situation where your international health insurer and Medicare both claim the other is the primary payer for a U.S.-based claim. This creates a claims processing delay that can last months and leave you managing large interim bills. The solution is to designate in writing with both your insurer and Medicare which policy is primary for U.S.-based claims before you travel. Your international health insurance broker should be able to facilitate this documentation. The second scenario is the chronic condition escalation problem. International health insurance policies are generally structured for discrete medical events, an injury, an infection, a surgery. Chronic condition management, monthly specialist visits, ongoing medication adjustments, regular imaging, often runs into coverage limits, annual benefit caps, and prior authorization requirements that create friction during precisely the period when you need seamless access to care. Before you purchase any international health insurance policy, ask the insurer specifically, what are the annual and lifetime benefit limits for the management of my specific existing conditions? Get the answer in writing. If the insurer cannot provide a written response to that specific question, find a different insurer. Country-by-country healthcare snapshot. Let me give you a fast comparative snapshot of the healthcare landscape in the 5 most common retirement destinations, so you can calibrate your protection architecture to your specific location. Thailand has the most developed private healthcare infrastructure for foreign retirees in Asia. Bumrungrad International in Bangkok sees over 1.1 million patients annually, including 520,000 international patients. English-speaking specialists across all major disciplines are standard. Private consultation costs are 15 to 30% of U.S. private rates. The public healthcare system is accessible to retirees on long-term visas, but operates in Thai and has significant capacity constraints outside Bangkok and Chiang Mai. Portugal's SNS national health system is accessible to legal residents and provides genuine comprehensive coverage, including specialist care, surgery, and hospitalization at minimal cost. Wait times for non-emergency specialist referrals in the public system can run 4 to 8 weeks. Private health insurance fills this gap efficiently and at reasonable cost for European standards. Panama's private hospital sector, anchored by Hospital Punta Pacifica's Johns Hopkins affiliation, is the strongest in Central America for English-speaking internationally credentialed care. The Public Social Security Health System, CSS, is accessible to pensionado visa holders, but operates at a different standard than the private sector. The pensionado program provides a 15% discount on hospital services and 10% on medical consultations in private facilities, which partially offsets insurance premiums. Malaysia's Penang is one of the most developed medical tourism ecosystems in Asia. Gleneagles Penang, Penang Adventist Hospital, and Island Hospital all operate with English-speaking staff, international patient coordinators, and costs that run 20 to 35% of equivalent U.S. private rates. The Malaysian public health system, though accessible to MM2H visa holders, operates primarily in Malay and is not designed around the foreign patient experience. Costa Rica's private healthcare sector, anchored by Hospital SEMA and Clínica Bíblica, both in San Jose, is the strongest in Central America outside Panama. The public Caja system is accessible to legal residents including pensionado visa holders, operates in Spanish, and provides genuine primary and secondary care coverage. For retirees with complex conditions, the private sector in San Jose is the appropriate primary healthcare environment. The fiduciary verdict, cost model. Here is the complete annual healthcare cost model for a 65-year-old couple with moderate health complexity, 1 managed cardiac condition, 1 type 2 diabetes, in 3 scenarios. Scenario A, they remain in the United States. Medicare Part B premiums, $2,074 per year combined. Medicare Advantage plan premiums, $1,800 per year combined. Out-of-pocket maximum under Medicare Advantage, $7,550 per person, $15,100 combined. Average annual out-of-pocket costs for a couple with chronic conditions under Medicare Advantage, $4,200. Prescription drug costs not fully covered under Part D, $1,800. Total annual healthcare cost exposure, $9,874 in premiums and average out-of-pocket, with a maximum exposure of $20,974 in a bad health year. Scenario B, they move to Porto, Portugal. International health insurance with Zone 1 worldwide coverage, full medical underwriting, $2,000 annual deductible, $9,600 per year for the couple. Deductible cost in a year with one significant claim, $2,000. Portuguese private hospital consultation costs not covered before deductible, $600 estimated. Total annual health care cost, $12,200 in a claim year. In a healthy year with no significant claims, $9,600. Medicare Assist annual membership, $550. Adjusted total, $10,150 per year baseline. The raw premium cost is higher in Portugal than in the U.S. Medicare Advantage scenario, but the maximum exposure, the catastrophic financial risk, is structurally capped by the insurance architecture in a way that Medicare Advantage's $15,100 combined out-of-pocket maximum is not, and the quality of access, no network restrictions, direct access to English-speaking specialists, no prior authorization delays, is substantially higher. Scenario C, they move to Chiang Mai, Thailand. International Health Insurance Zone 2, excluding U.S., full medical underwriting, $1,000 deductible, $5,400 per year for the couple. Thai private hospital costs are so low, $20 GP visit, $35 blood panel, $90 MRI, that even with a $1,000 deductible, annual out-of-pocket costs rarely exceed $800 in a routine year. Medicare Assist, $550. Total annual healthcare cost, $6,750, versus the U.S. scenario's $9,874 baseline. Thailand produces a $3,124 annual saving on healthcare alone, while delivering a demonstrably higher standard of access, shorter wait times, and no prior authorization bureaucracy. Over a 20-year retirement, that differential is $62,000 in compounded savings on healthcare costs alone before factoring in cost of living arbitrage on every other expense category. Strategic call to action. Healthcare planning is the most consequential financial decision in a retirement abroad. It is also the one that most retirees address last when it should be addressed first. We have built a complete international healthcare planning checklist for RetireNest subscribers, a step-by-step framework covering insurer evaluation criteria, the pre-existing condition disclosure process, JCI hospital research by country, the medical information document template, and the Medevac provider comparison. It is available free at the link below. This channel does not accept commissions from insurance companies or healthcare providers. Every comparison and recommendation we produce is funded by our community and built to give you the same quality of analysis you would pay a specialist insurance broker to produce. Subscribe to RetireNest. The next video in this series is the one most requested by our community. A head-to-head comparison of the 4 major international health insurance providers for retirees over 60, Cigna Global, Allianz Care, AXA Global Healthcare, and Bupa Global, with real premium quotes, real coverage limit comparisons, and real claims experience data. That video drops in 2 weeks. If you have a specific healthcare planning question, a pre-existing condition you are worried about, a country you are researching, an insurance clause you do not understand? Leave it in the comments. We read everyone.